40% of women have dense breast tissue, which puts them at higher risk for developing cancer and for cancer to be missed on mammograms. Testing can reveal this issue, but many aren't sure what to do with the diagnosis. Here's NPR's Yuki Noguchi.
A Pittsburgh woman named Joy remembers her own mother diligently getting her cancer screenings.
She had her mammograms every year.
But, like Joy, her mother had dense clusters of glands and tissue in her breasts. That likely obscured the tumors on her 2D black and white mammograms until it was too late.
She was diagnosed at age 43, and by 48 she was gone.
So when Joy herself turned 43, she enrolled in a breast imaging study. Her mammograms found nothing, but researchers followed up with high-contrast images and told her,
"We think we see something."
Joy did have cancer, but it was caught early enough to remove it completely. Joy didn't want to share her full name because she hasn't discussed her diagnosis widely with colleagues, but she wanted to share her story to advocate for easier access to follow-up MRIs for women with dense breasts.
I think it should be more automatic.
Getting follow-up images is usually not easy. MRI machines are in short supply, and out-of-pocket costs for an MRI can cost as much as $1,000, says Krissa Smith, Vice President of Education at the Susan G. Komen Breast Cancer Foundation.
Cost is the biggest barrier, and most of the supplemental imaging is not covered by insurance.
Smith says family history, weight, and lifestyle can factor into one's risk, so it's best to talk to a doctor.
It really has to be a conversation with your doctor, because if you have other risk factors, a family history of breast cancer, that's going to be a more targeted conversation for you and what you need.
Dr. Wendy Berg did that a decade ago.
When I had put in my own risk factors into the risk models and determined that I, in fact, was high risk, and I knew I had dense breasts, I contacted my doctor and I said I would like to get a screen MRI. And he said, "Well, remind me why you want to do that?"
Berg researches radiology and breast imaging at the University of Pittsburgh. One of the biggest problems, she says, is many doctors themselves are not familiar with the latest science. According to Berg's own findings, mammograms can detect, on average, 5 cancers in 1,000 patient scans. Ultrasounds can catch 1 or 2 more.
We added a screening MRI and found another 15 cancers per 1,000, even after the mammogram and ultrasound.
Yet, because of cost, complexity, or lack of awareness, Berg says fewer than 1/10 of eligible patients get follow-up MRIs. Berg is also Chief Scientific Officer of DenseBreastInfo.org, an educational website. She says she benefited from her own advice with the MRI she pushed her doctor for 10 years ago.
As luck would have it, that MRI showed a small invasive cancer that is not visible and is not visible in retrospect on my mammogram.
Berg says women need to push their doctors and insurance companies.
It remains incumbent on the woman herself to look at her risk factors, to talk to her doctor and say, "Hey, I'd like to get an MRI." Don't wait for them to recommend it to you.
For the many women with dense breasts, it could be a lifesaver. Yuki Noguchi, NPR News.